Morning, everybody. I'm Leodge Lazarus. I welcome you to hear the presentation from the United Republic of Tanzania. In previous, we used to come the Technical Working Group of Tanzania, but today we are the United Republic of Tanzania. So I will start by the introduction. The government, through the Ministry of Health and Social Welfare, has a coordination mandate and support structures for child protection in Tanzania mainland. And the Ministry of Empowerment, Social Welfare, Youth, Women and Children is mandated in the other side of Tanzania Zanzibar. So we have Tanzania mainland and Tanzania Zanzibar, because issues of children are not matters of union, so we have two different ministries that operate in the country. On the coordination, generally, both sides, we have the multi-stakeholders child protection committees at national and district levels. At national, we have the interministerial and the high-level officials. At district, we have the technical coordinating bodies. Just to share a few, on the mainland, we have the national child protection structures according to the NCPS 1, where our colleagues also in Zanzibar, they have got their own NCPA. Starting from the highest level, we have the National Steering Committee, and then we have the National Technical Committee. Also, we have the National Child Protection and Advisory Committee, which is the subcommittee of the National Technical Committee. But also, we have got implementing partners, where now under the implementing partners, we find the Child Protection Technical Working Group, which is a subgroup to the IPG. At regional level, we have the district child protection teams, ward child protection teams, Mtaa, village or Shehia. These are the lowest level of coordination when it comes to the issues of child protection. So we look on the legal and regulatory environment, what has been done so far. Since I said that issues of children are not matters of union, then we have two different laws that address issues of children in the country. So in Zanzibar, they have enacted the Child Act number 6 of 2011 in Zanzibar, while in Tanzania we enacted the law of the Child Act. So we have the law of the Child Act in the mainland, and we have Children Act in Zanzibar. So far, finalization of the national guideline for establishment of child protection system have been done in both sides, in the mainland and in Zanzibar, whereas we have the National Child Protection Training Manual in both sides, but also GBV and VAC curriculum for health workers, social welfare officers, and TOT are ready, and there are trainings going on in the mainland. With the judiciary, we have the juvenile code rules in both sides, and police have been developing, and they are in different levels of finalization. The issues of police are union, so things are similar. Also, in both sides, we are finalizing the national guidelines for establishment of child protection systems. On the mainland, we have the child development policy is now reviewed, and we also developed a national communication strategy in support of the NCPA 2. Also, the government is implementing a progressive child justice reform strategy This strategy is being coordinated by the Ministry of Constitution and Legal Affairs and in an advocacy dialogue through the Child Justice Forum. So we have this forum which comprises both people from the government and the non-government stakeholders. Also, under this, we also do some development on the number of regulations of Children Act in Zanzibar, whereas child protection regulation in residential establishment and daycare are at Attorney General Office for comment, that's for approval in Zanzibar. But foster care, adoption, children, juvenile code rules are still on progress of development in Zanzibar, while in the mainland we are done with that. So we are doing the finalization of set of regulation rules under the law of the Child Act, including the juvenile code rules, child protection regulation in the mainland. We are done with that. But for our colleagues in Zanzibar, they are still on the progress. Okay. In Zanzibar, they have developed the National Guideline for Protection and Welfare of Children. Also, they are doing a review on child survival, development, protection policy. This is still in progress. And also, they are doing the review of evidence decree by law review commission. So they are just like highlighting issues of children in the review. Of course, the issues of police again is the matter of union. So we are doing the finalization of regulation and the Anti-Trafficking in Person Act, and we're also developing the standard operational procedures for assistance to victims of trafficking. This is the matter of union, so it's all over the country. And with that, then there is impending training for national team on the SOPs. Again, an assessment of situation of ECD in Zanzibar has been conducted from last year, where gaps were identified with recommendation. Also, steps have been taken for community rehabilitation programs to avoid children offenders from being sent to prison. This is being done in Zanzibar, but also in the mainland there are some progress on that. Again, we have developed the National Communication Strategy in support of the NCPS in the mainland. In the mainland, we are done with the National Psychosocial Support Guideline, which was developed and it is now shared among key stakeholders and frontline workers so that they can materialize to ensure that abused children receive these services. But also, we are in the finalization of the National MVC, Most Vulnerable Children Monitoring and Evaluation Plan for the mainland. This is for the mainland. This guideline will address teachers' code of conduct and the other child protection matters in school setups, so that to ensure that children are safe when they're in school. To enhance the capacity of national institutions, the government has established the standard. We are trying to work out to have a standing alone social welfare department at district level. So some dialogues are ongoing between the various ministries that are concerned with that. Also, the Ministry of Home Affairs launched the Gender and Children Desk and 3-year action plan demonstration police commitment to strengthen its response to gender-based violence and violence against children was launched, and there are some progress that the police force are doing to ensure that they go with the current challenges that children face in the country. But also some advocates to district executive directors and district council councillors to ensure that to ensure their commitment to support the role of child protection system or the establishment of child protection teams in their areas of jurisdiction. Okay. Also, the government plus the development partners, we are supporting the local government authorities to facilitate the establishment and the strengthening of child protection teams at district, ward level to ensure that most rural children play active roles in addressing children protection issues at village and the mtaa level or Shia level in Zanzibar. So we have about now 17 districts that have established the child protection teams from mainland and the Zanzibar. Okay, RITA, among other issues, they are implementing a birth registration strategy for all children under 5 years with support from UNICEF and the other development partners, because it was a challenge for us. But also support the development, we're supporting the development of the national guideline for household economic strengthening to ensure vulnerable families access to capital to support their well-being. So with that, the national guideline for household economic strengthening has been developed, tested, and the final draft has been shared with stakeholders for utilization. And also with the Ministry of Finance, they have finalized the national guidelines for child protection budgeting, and the training have been done to TOTs so that I can go to the districts to share the knowledge and train the district officers to have a separate budget for child protection issues. Okay, in Zanzibar, they have established child protection unit within the Ministry of Empowerment, Social Welfare, Youth, Women and Children, where they have one office in Pemba and one office in Unguja. But also over the country, we have about 8 one-stop centers which have been established, where we have 3 in Unguja, 3 in Pemba, and these stop centers are located within the regional hospitals, and we have 2 in the mainland. Gender desk and children desk at police stations, they have been established in each district. Also, in Zanzibar, they have 2 safe houses for victims of abuse, where children aged 13 and women are temporarily sheltered. This is in Zanzibar. Again, we have a national child helpline, which was launched last year, and now our number, our code is 116, and it has been activated and it is in use. We had the challenge of having few counselors. Now the Department of Social Welfare is planning to allocate more social welfare counselors at the child helpline calling center for it to operate 24 hours, because currently it operates 12 hours. Yeah. In Zanzibar, again, they have developed a child protection unit for child witness and the victim at the DPP office to ensure that they get justice. Okay. Again, we have developed the National Standard Child Protection Training Manual for the mainland in Zanzibar, and the TOT have been trained, and the trainings to different target groups on the national guidelines, training manual, and the ECD were conducted to various stakeholders, starting with the district child protection teams, the most vulnerable committees, teachers, counselors, and other frontline workers in the country. Child rights and protection and social work courses have been introduced in Zanzibar, Zanzibar University and the State University of Zanzibar at diploma and degree or bachelor levels since 2012. But also there are some initiatives to incorporate child protection in social work curriculum in Zanzibar. On the mainland, so far, social work master's program have been introduced in the country. We have the course is being offered at the Open University of Tanzania, the Herbert Kairuki, and the Institute of Social Work. Curriculum for social welfare assistant was also developed, and the students have been enrolled for studies at Sangara Social Welfare Institute. And in this institute, we basically focus to train social welfares who will be deployed to ward and village levels. Again, with the training manuals, 15 core core team has been trained and facilitated to train the national facilitators, where we have a number of 30 facilitators, national facilitators, who are multi-sectoral, have been trained and facilitated to train district child protection team across the country. With the police, they have a number of 1,412 police have been trained on gender and children desk, to be gender and children desk officers, and they have been trained on the national manual and the guideline for managing the gender and children desk around the district of the country. So when children go to this police station, then they meet the professional police officers. Also in Zanzibar, they have developed the working protocol for police, health officers and teachers, also training the social welfare officers and the other district child protection members on child protection manual, child protection budgeting guideline, and CPIMS. CPIMS is Child Protection Management Information System. With supporting the research and data management and dissemination, so far we are doing some dissemination of the law of the Child Act and the Child Act in Zanzibar. Also the regulation in the mainland and the Child Act in Zanzibar. In Zanzibar, they have developed the special reporting forms that are used at local and national levels. They also have the web-based National Child Protection Database. For the mainland, we have a National Child Protection Information Management System manual, which have been developed and tested, and it is now working in all the districts that we have established child protection teams. So our target is to operationalize the CPIMS in all the districts with child protection team. Child Protection Information Management System manual, again, it was developed and tested. The national team also was trained. Also, we are doing some dissemination of the national guideline for the establishment of child protection system in other districts where we have not established the teams. Dissemination and the training of social welfare and the other frontline workers on the law of the Child Act, regulation, with particular attention to child protection regulation and the other protection in general. But also dissemination and training of social welfare and the other frontline workers on the national guideline for household economic strengthening. Challenges. We have a low budget for coordination activities, resources to coordinate the country technical activities in relation to the regional strategy, insufficient number of counselors at one-stop centers, child helpline centers, and in schools, inadequate number of district social welfare officers to deal with child protection. They are not, the social welfare are not in all districts sometimes, or you find there are few, one or two in a big district. Child abuse data entry in DMS, this is data management system, mainly in Zanzibar, is a challenge due to lack of human capacity, internet access, and as well as equipment at district level and one-stop centers there are no computers sometimes and things like that. No comprehensive reporting procedures yet at schools that will allow students to report risk of abuse or whenever abuse is happening. And most of the teachers, counselors lack child protection knowledge and early signs of and symptoms of child abuse. Commitment of local government leadership in supporting children issues, where we look on the inadequate financial allocation or technical resources budgeted in the implementation of child protection matters. Again, human resources in all setups, and sometimes systems do not communicate. We find we have different actors, but we don't have anywhere to meet and share the finding challenges and gaps. And most of the programs that deal with children are donor dependent. Most cases of child abuse are not reported in the formal referral system. Still a challenge. Some action taken to tackle the challenges. We are doing some we mobilize district authorities on the resource allocation towards child protection activities. That's why we worked with the Ministry of Finance to come with the manual. We also advocate the Ministry of Labor and Public Services for social welfare officers recruitment and deployed to district and village and wards levels. We also have an initiative to make an assessment on the best way of having DMS, the data management system in Zanzibar, rather than the web database. But also the other action is that we now have the one article on children's rights, which has been featured in the new proposed constitution. As you know, in Tanzania, we are in the process of changing our constitution, and the previous constitution had no any article that featured children's rights. So the current one, we are in good terms with the government. Asante sana.
My name is Caroline Olilo from the Children's Department here in Kenya. First of all, I'd like to commend Tanzania. That's Tanzania?
Yeah, Tanzania.
Yes. Yeah, based on your presentation, you seem to be doing a lot. Yeah, kudos to you. And on counter trafficking in persons activities, you seem to be ahead. And probably from Kenya, we can borrow a leaf from you, so we can have some exchange program when it comes to counter trafficking in person. And now, when we go back to the last bit of your presentation on the CPIMS, on the database, the last part of the presentation, I have a question there. Your CPIMS is web-based? Did you say?
We have two different, in mainland we have the CPMS.
Okay.
In Zanzibar they have web-based.
Okay. And then there was a web-based national. There was something to do with web-based. You prefer the DMS. I wanted you to clarify on that you are working on there's somewhere in your statement, the very last presentation, not challenges, actions you've taken to tackle the challenges.
Previous, even mainland, we had DMS, data management system, and this was the response to the first national custody plan of Action 1. In that national custody plan of Action 1, we were talking about most orphans and most vulnerable children. And we had DMS as the data, as a tool to collect some data, and it was web-based. And we had some challenges on that, because in some districts it was very difficult due to internet issues, And again, it was challenges because some of the computers did not have big memories to accommodate data, and most of the computers collapsed. So DMS, we had it in Tanzania mainland, in that National Coastal Plan of Action 1, and it is still existing, although it is not functioning well. And again, we have NCPS, Child Protection Management, Information Management System, that is capturing child protection issues for the issues of child abuse. That is CPMIS. Although DMS is there, but it has some challenges. I can't really say it is dead, but it is there, although it has some challenges.
A child rights pillar that I've noticed has been missing in most of the presentation. So I don't know whether it is a deliberate move or it's a no-go area based on some reactions that we got yesterday. I've noticed that child participation has not been handled in most of the presentations. So maybe I don't know whether there's challenges there or where maybe what is the main issue we are not addressing or maybe visiting that area as a child protection, one of the child protection areas.
And mine is, it's just to take some lesson, experience on rehabilitation of children in conflict with the law. And I saw in the report that the rehabilitation of children in conflict with the law is taken to the community. And I'm curious to know how they are working on it, because we have some initiative in some part of our countries. It's just to have.
We have a very clear organization or arrangement of child participation in the country, where we have the National Children Council, and this the council is from the grassroots, from village level. Then from village we have the ward, where we have the junior council. From ward we have the district. From the district we have the regional junior council, and from the regional we have the National Council for Children. So junior councils. So and what we are trying to do was to ensure that they attain the legal existence in the country, so that with the ongoing constitutional changes, that was one of the issues that was highlighted in the Constitution. So a lot have been done, and children are participated in all levels. And when you come to these structures of child protection, for example, if you look on the district child protection, we have two representatives from the junior councils. You go to ward level, we also have two representatives from the junior councils. In the village, we have two representatives in the most vulnerable committee. I'm not sure in the national level. There is some gaps to incorporate children in the structure that I mentioned earlier. But we do welcome them mostly times in the IPG, the meeting that we used to hold. Children issues are represented.
On the child protection, the responses it just gave, I just wanted to add that they all operate under the framework of the National Child Participation Strategy, which is being coordinated at the Ministry of Community Development, Gender and Children. And a couple of years back, the ministry developed what is called child participation toolkit, which has been disseminated in different districts in the country. So that's the framework within which child participation is applying.
The other question was concerning children in conflict with the law. I think on the presentation we had mentioned that we have a community rehabilitation program. I think it was that we need to know more. In Zanzibar, because Children's Act was enacted, and the Children's Act has basically focused on two main areas of child protection. children in contact with the law as witness and victim, and children in conflict with the law. So among the implementation processes in children in conflict with the law, we have decided to initiate community rehabilitation programs because we have seen that there are gaps in our prison, and children who are offenders are sent to prison, and there they are mixing children with adults. So whenever the children are coming out from there, they are learning more things which they are not supposed to be learning. So we have established, we are still in process, we have just started the initiative of mapping an NGO that will be working with government to take the role of this program. We are still on process, we just have started initiative. But the focus is to send the children in community to be managed at the community level instead of sending them to prison, and to prevent reoffending of any type of offense, so that even the public will stay safe. So that's the whole concept of the community rehabilitation program.